Good evening and welcome to For the Record. Measles is a very contagious disease, and despite having an effective immunization program in Fiji, there have been cases of outbreaks around the country. To further this discussion tonight, we have with us our guest, Dr. Alisha Sahu Khan, Head of the Health Protection of the Ministry of Health and Medical Services. Good evening and welcome to the show, Doctor.
Thank you for having me.
So before we get into the vaccine and also what happens if people out there don't get immunized, let's have an overview of measles itself. What is it?
Okay, so measles is a disease caused by a virus. It used to be a very common disease in childhood until we got an effective vaccine. So it was a disease that would pass particularly between children. Most people who got the disease would have a fever with cold-like symptoms, running nose, a cough, watery eyes, and then about 3 to 4 days after that, you'd develop a rash. You'd be sick for about 8 to 10 days. There's no specific treatment for measles, so you'd rest at home with paracetamol and make sure you're getting enough fluids, and then you'd get better. However, there are a group of people, a percentage of people who develop severe complications from measles. So the complications from measles include severe diarrhea, pneumonia, which is infection of the lungs, encephalitis, which is an infection of the brain. These are very serious complications that result in hospitalization and also deaths. So the WHO estimates that from the year 2007 to 2017, about 20 million deaths from measles, particularly for children under the age of 5, have been avoided because about 80% of children in the world are receiving at least one dose of the measles vaccine. 20 million deaths. Even with that, between 2000 to the year 2017, there have been 20 million deaths avoided, but in 2017, there were about 100,000 deaths worldwide for measles. So this is predominantly in countries that don't have access to the vaccine. Countries that do have access to the vaccine, like Fiji, measles has been almost eliminated as a public health problem. So in Fiji, typically we have 0 cases of measles a year. Our last outbreak was in 2006, and before that in 1998. But of course, some of us may remember that Fiji has had a very dark history with measles. When it was first introduced into Fiji in 1875, it killed about 40,000 people, which was a quarter of our population at the time. It had never been here before, so it came to a country that had no immunity to the disease, and it killed 40,000 people. So since then, from the 1875 onwards, we had regular outbreaks, and as I mentioned, it was a very common disease in childhood. So people who were born before 1982, when the vaccine was first introduced, will remember that, oh yes, I got measles. I used to get a fever and a rash, and my friends got it, and we got better. We were sick for a while, and we got better. So what's the problem? Well, the problem is that you may have gotten better, your friends may have gotten better, but there were children who got very sick and ended up in hospital, and first of all, they may have died. A lot of children did die from measles, or they got really bad complications and severe disability that would have been long-lasting.
So you've mentioned that 2 doses are necessary. When are these administered?
So, as I mentioned, the vaccine was introduced into Fiji in 1982. In most developed countries like Australia, New Zealand, the United States, the UK, it was introduced in the 1960s, the late 1960s. Fiji did not get the vaccine until 1982 as a single dose until 2003. We know that in the 80s our coverage was quite low, but in 2003 we introduced 2 doses of the measles vaccine. So one was given at 12 months, and the other one was given at school entry. So children born from 2003 onwards, we know, should have received at least 2 doses of the vaccine.
This is part of the ministry's immunization program, the schedule that is carried out. For anyone that has gone to primary school, they have been visited by the Ministry of Health officials, and they have been immunized against various diseases. Of course, one of them is tetanus. You get the rubella shots as well, and measles. Looking at this particular disease, is it necessary for one to go for booster shots, as they say, or is one vaccination that you received prior to 2003 enough to cover you for years to come?
So what we are trying to do is make sure that our herd immunity So the immunity within the population is at a level where we're able to prevent outbreaks or the spread of the disease. So to do that, the main way we do that is making sure that we get good coverage in our childhood immunization program. We make sure that all of our children are receiving their vaccines as scheduled. And the way you know if they're receiving that is because every baby in Fiji, when they're born, are given a card. It's called the Child Health Record. And in that card, you're advised by your nurses that you need to come to a health center or be checked by a medical professional every so often with your baby. And there's a schedule of vaccines that a baby needs to receive within the first year of life. And one of those vaccines is the measles rubella vaccine. It's a combination vaccine. It's called MR, and that's received first at the age of 12 months. The next dose of the vaccine, up until 2017, was received at school entry, so in class 1. That was the second dose. From 2017 onwards, we've been giving that dose when the baby is 18 months old, but children are still receiving the school entry dose until 2021. So if you check and your child has received both doses of that vaccine, they are protected against measles. Mm-hmm. So what we're trying to really push forward is that parents need to check their children's immunization records to make sure that they've received 2 doses of the vaccine.
Mm-hmm. With that in mind, which age groups are the danger groups, which are more at risk of contracting the measles if they haven't been immunized?
So for this outbreak, as you know, we've got 4 confirmed cases in Seronomosi, specifically in the Wailali settlement in Wainandoi. So what we have done is said that everybody in Seronomosi needs to make sure that they have received the vaccine. So we're saying anyone who lives in Seronomosi and is above the age of 6 months, is not pregnant, has not had any allergic reaction to the vaccine in the past, is able to receive the vaccine. So we have nurses, groups of nurses and the medical teams actually visiting settlements in Seronomosi right now, trying to get all of these people vaccinated. There's been a vaccination tent set up at Navu Hospital to try and get everyone in Seronomosi vaccinated. We're getting about, I think, 1,000 to 2,000 people every day coming to Navu Hospital to get vaccinated. As of yesterday, 95% of Wainandoi settlement has been vaccinated, and the teams are expanding beyond that to the rest of Seronomosi. So that is a target group. So children, we need to make sure that all of our children have received at least 2 doses of the vaccine by the time they're in school. Everyone who lives in Seronomosi has access to the free vaccine. And the other group, of course, is people who are traveling internationally. Mm-hmm. If you're traveling overseas, we are asking that you check your immunization records. If you have received the vaccine in the past, you should be okay, especially 2 doses of the vaccine. We consider that you're immune. If you're not sure or you haven't, you need to get vaccinated, and we're advising that at least 2 weeks in advance, because sometimes it takes about 2 weeks for your body to mount the immunity that will protect you from the disease.
When we're back from the break, we'll be back with more on the discussion about measles. Welcome back. Dr. Sahu Khan, let's continue from where we left off. We're talking about the importance of getting vaccinated, and one of the risk groups that you talked about was those who are traveling. Now, this doesn't necessarily mean those who are traveling overseas, but also those who are traveling within the country. Unfortunately, we have groups of people who do need to travel daily, and they have to pass through the Seronomosi area. What would you advise them, and how early do you want them to go for their vaccinations?
Okay, so one of the groups we are targeting for vaccination of people who travel, because we know people who travel internationally in particular are more likely to get in contact with people with measles. So we don't have measles normally in Fiji. So outside of this current outbreak, measles is not a disease we expect. We know when people travel overseas to other countries may have outbreaks of disease. We have outbreaks in Auckland, there are outbreaks in Samoa and Tonga. Even in Australia, there's been outbreaks in Brisbane. So we know that when people are traveling, they're more likely to be exposed, and if they're not immune, you will likely get the disease. Within Fiji, we're saying if people travel to Seronomosi yes, you should be you should check your immunization status, and if you're not sure about it or you haven't received the vaccine, please get vaccinated beforehand. But I know Seronomosi is on the way to the other side of the island. We're not saying if you're driving through. If you're driving through Seronomosi, it's very unlikely you'll be exposed to the disease. It is if you're going for some reason, you're visiting relatives, for example, if you have business in Navua, yes, those are the groups of people that we're saying should be vaccinated. So driving through Seronomosi, no, the risk is not elevated just because you're in a car and you're driving on the road. It's if you're specifically visiting any part of Seronomosi.
Now we've got the school holidays that are just around the corner. That would obviously mean quite a lot of children will be finishing off from their boarding schools. There'll be family and friends visiting each other for the holidays and spending extended periods of time with them. For those that are going there, how early do they need to go? You said 2 weeks, and that is the 2 doses that they get at once, or is that a single dose that they get again, even for adults?
Yeah, so we're advising if you travel to Seronomosi, get vaccinated at least 2 weeks in advance. This is because it can take up to 2 weeks for your immune system to mount enough of a response to be able to protect you from the disease. So we do advise 2 weeks in advance.
And that's also for those who are planning to travel overseas. Of course, if they have their tickets already booked, what do they do then? Say, for example, if someone is to travel tomorrow to Australia, or maybe next week they have to go, what do they do then? Is there any other option available for them?
Yeah, so the advice is 2 weeks in advance, because it can take some time for immune system to kick in. However, if you are going tomorrow, yes, we still advise you get vaccinated.
Right.
So the advice is to, ideally within 2 weeks beforehand, but the best, if you're going tomorrow, if you're going in 2 days' time, still get vaccinated. Don't not get vaccinated because, you're within that 2 week period. Our advice is, if you're going to travel internationally, please make sure that you check your immunization status. If you have not received the vaccine before, you're not sure of your vaccination status, do get the vaccine before you travel.
There are some that might be ignorant enough to say, well, border protection has to be prioritized. You must screen every single person that comes through. But there's no way of knowing whether or not visitors that are arriving into the country on an hourly basis have been vaccinated or not.
Yes. So one thing, it is a very resource-intensive exercise to screen people at the border. Fiji is a hub in the South Pacific for international travel. We have hundreds of people coming in every day. So the resources we would have to expend to do that at the border is taking away from other areas that would actually is scientifically proven to be more effective in preventing outbreaks. The other reason that border control is less effective is because we know measles has a period. You can be infected with measles and not be symptomatic for a while. So you can be fine, you can be not sick at all, passing through an airport, and you will not be picked up by that screening.
This is just like when you have dengue. You have the infection in you, you have the virus in you, but you don't show any symptoms.
Yes, and in measles in particular, you can be in this period. You could still be infective. You could still be infecting people around you, and also the early symptoms of measles are very non-specific. They are symptoms like a fever, cold symptoms like a running nose, a cough, watery eyes, which can be a number of any other diseases, include normal viral infections. So if we start stopping people at the border who have those symptoms, it would be very counterproductive to the response within the country. We know that in order to contain measles, the best response is making sure first that your coverage, your immunization coverage in childhood is very good. So in Fiji, we know that our coverage is good. It is at around 95%. The reason we know this is because at the end of 2017, the Ministry of Health, through our Family Health Division and the divisions, the Northern, Eastern, Western, and Central divisions, did a mass vaccination campaign for measles and rubella for every child that was between the ages of 1 to 10. So basically, this is an extra campaign on top of the routine immunization that we have. So within a period of, I think it was 8 weeks in September, between September and October, the nurses went out physically searching out children to get vaccinated, and we covered 95% of the 1 to 10-year-old population in Fiji.
Mm-hmm.
So we are confident that at least that population is protected,
Mm-hmm.
and that we have achieved good herd immunity there. That being said, we know that there's still a risk of people contracting the disease when they're traveling, and because we have an outbreak in Cerro Namosi,
Mm-hmm.
we're saying that everyone in that region needs to be vaccinated.
When we're back from the break, we'll continue the discussion on vaccination programs around the country. Welcome back. Dr. Sahu Khan, let's look at the Ministry of Health and Medical Services. Of course, the name itself means that they should be well equipped to deal with outbreaks, but resource funding sometimes comes into question. You also look at capacity and whether or not the ministry is going to be able to handle outbreaks like this. Talk to us about whether or not the ministry is equipped enough to deal with an outbreak if it goes on a mass scale.
Mm. So I think I'll just tell you a little bit about what happened with this current outbreak that has been declared in Cerro Namosi. So we have been aware that there have been outbreaks in the region, and in order to address these, we have been preparing within the Ministry of Health. In July, there was actually a New Zealander who passed through the Nandi airport in transit to Los Angeles, and we were notified later in early August that they were tested positive for measles in the US. So this is a New Zealander who came from Auckland, transited through Nandi, was in the airport for a couple of hours. This was on July 23rd, and then moved on to the US. So at that time, you may remember there was a press release that came out that was warning people who were in the airport that time that they may have been exposed to the disease.
Mm-hmm.
Fortunately, in response to that outbreak, we were able to, it was a very intense exercise to actually trace everybody who came in on that airplane, people in the airport. We managed to vaccinate most of the frontline staff that were in the airport, and also trace the people from the airplane that went around Fiji. Thankfully, we did not get any cases from that one case that passed through our airport. But we knew that we have to be prepared. So the Ministry of Health conducts annual training in outbreak response for all of our divisional teams. So each division, we have 4 divisions within the Ministry of Health. There's a geographical division, so North, East, West, and the Central Division. They have outbreak response teams. So every year they're trained by our Fiji Center for Communicable Disease Control, or Fiji CDC, in responding to outbreaks. So this year we had a specific training or scenario on measles, and our subdivisional teams, our outbreak teams, had to come up with a strategy, a plan for what would happen if they got a suspected case of measles in their health facilities. So it happened that last week, before the outbreak was declared, we had a team from Cerro Namosi, led by their subdivisional medical officer, Dr. Anaseni Maisema. They were in that training, and we were on the final day of the training. They were just about to present their measles response plan when the medical officer, Dr. Anaseni, was informed of this 4-month-old baby who had presented to Navo Hospital that morning, and her staff at Navo Hospital sent her photos of the rash, and I was sitting right next to her. And because of that instant notification, and because of the training that was received, they were able to respond rapidly, quickly isolate the baby in the hospital, get a good history from the mother, and realizing that there were 2 other people in the community that had similar symptoms. So they're able to respond within the hospital and isolate, as well as go out to the community, try and find these 2 these adults, get blood sample, etc., and also send it off to Fiji CDC to get tested. We are very fortunate in Fiji that we do have the testing available within Ministry of Health for measles. Mm-hmm. So they did exactly what they needed to do in Cerro Namosi. They treated a suspected case as a case, put in all the measures to isolate and contain and prevent further transmission. And then later that same night, which was the 6th of November, last Wednesday, we got confirmation that the 2 adults had tested positive. The baby was had an unequivocal result that was later confirmed as positive. And then the very next day, Thursday, the 7th of November, we sent out a press release announcing the outbreak for Cerro Namosi. So since then, we've got 4 confirmed cases, and they're all within the Wailali settlement in Wainandoi in Cerro Namosi. What the Ministry of Health is doing right now, the team in Cerro Namosi, the nurses that are there, the subdivisional medical officer and her team are working very hard to try and contain that outbreak within that settlement and within the Cerro Namosi subdivision. And they're doing it in the ways that I've told you before. It's about isolating the case, making sure that they're vaccinated all the contacts around the case, everyone who's in that house, and then they're expanding that zone of vaccination to all of Wainandoi, which they've covered 95% now, and they're covering the rest of the subdivision. So trying to contain that disease within, because we know that if one person has measles, the way that we stop it from transmitting is making sure that everyone around them is immune to it. That will stop that disease from being spread and causing the spread of the outbreak.
So in terms of prioritizing what needs to be done to ensure that there isn't spread of the disease, you've already mentioned the vaccination schedule. You've mentioned that the Ministry of Health workers have been upskilled, they have been training. But talk to us about stocks of vaccines. Where are you prioritizing them?
Okay. So we have enough stock of vaccine right now to target for our target groups. And as I mentioned before, our target groups, of course, are always the children. We're always saying that children need to have received 2 doses of the vaccine. This is nationwide. The other target group is anyone who's traveling internationally, anyone who's traveling to the outbreak zone. The third group, and of course the most important one, as I mentioned, is everyone who's living in Cerro Namosi right now. And then, of course, we are targeting groups that are more likely to get exposed to a case coming in from overseas or to a health facility. So this is healthcare workers, everybody who works in the airport, in the airlines, in hotels. All of these groups are being targeted for vaccination, and this is happening right now. We've vaccinated most of the airport workers at Nandi International Airport, and healthcare workers around the country are getting vaccinated as well.
What about those who, shall we say, tend to jump the gun and want to self-diagnose, or a little hypochondriac, and they want to go and make sure that they get another vaccine done? Are they being turned away? What happens in those cases?
So right now we're aware that we have a lot of people coming to health centers wanting to get vaccinated. And we would like to just remind the public that in order to contain this outbreak, we are targeting these specific groups: children, international travelers, anyone who's living in Cerro Namosi, and healthcare workers and people who work at airports and hotels. For the rest of the country, I think what I want to share is that because we have such good vaccination coverage in childhood, that herd immunity that we develop is actually protecting the rest of the country. Because so many people are vaccinated, we have good vaccine coverage, it will actually protect the rest of the country. And the way we can most protect the rest of the country is preventing the outbreak spreading. And that is through the measures that we've put in, including targeting vaccination to these particular groups.
Bringing it back to the disease itself, measles, are there multiple strains of it? Do you need various types of vaccines for the various strains? Or is the vaccine that is being currently handed out or given to the public, is that enough to cover all the different variations of the disease?
Okay, so it's getting a bit technical, but there's one serotype for measles, and there are multiple genotypes within, which means that there's one main group and then multiple strains. However, the measles vaccine will cover you against all of that. So you do not need to worry about getting another strain of the disease. The measles vaccine will cover you for all of them.
When we're back from the break, we'll be back with more. Welcome back. Dr. Sahu Khan, something interesting came up while we were talking to some of our friends and family members, even some of our co-workers, and they mentioned that they knew for a fact that they had been immunized, not because that they could recall that they had been given the vaccine, but because they looked to either their left or their right arms, and they saw the 2 little pock marks that had been left from vaccination schedules that were handed out to them when they were young. Is that a clear indicator of being immunized from measles or not?
So that scar is from a different vaccine to the measles vaccine. It's from the BCG vaccine, which is given for tuberculosis in Fiji. So other developed countries currently, as far as I know, Australia, New Zealand, do not give this vaccine. So you notice kids from Fiji will have that scar, and then you compare it to your friends, etc., from New Zealand, Australia, they don't have that scar. So it's for a different vaccine. So just because you have that scar on you, it does not mean you received the measles vaccine. Yeah.
So there's no indicator unless you have that vaccination schedule card that you were talking about earlier that shows that you have gotten it, correct?
Yes, so that is our main source of information for
now
determining. Yeah.
Another worrying trend that is sweeping the entire globe, I suppose, is the anti-vaxxer movement. And I understand that it's counterproductive to dwell too long on it, but talk to us about this particular movement. We haven't had any massive talks about people trying to actively discourage people from getting vaccines. Of course, there are people of religious organizations and faiths that don't. But talk to us about the dangers of actually being part of this movement.
Okay, so what we call vaccine hesitancy is listed by the WHO as one of the top 10 threats to public health. That's because we have a number of infectious diseases that have been almost eliminated or even eliminated in some countries because of vaccines that are in danger of coming back because there are groups that are hesitant to vaccinate or completely against vaccination. So these are very preventable diseases that because people do not want to get vaccinated against, I have threatening countries like Fiji in terms of these diseases coming back. So the measles vaccine in particular, it was first developed in the 1960s, introduced into developed countries, wealthy countries, in the late 1960s. So like New Zealand, I know, was in 1969. Fiji did not get the vaccine until 1982. So since then, it has been given to hundreds of millions of children around the world, hundreds of millions of people around the world. From the year 2007 to 2017, I think I've talked about this before, the WHO estimates that 20 million deaths have been prevented because 80% of children under the age of 5 around the world have received at least one dose of the measles vaccine. 20 million deaths. And in 2017, still, there were over 100,000 people who died worldwide because of measles, and that's an 80% decrease since 2007 because coverage of the vaccine has increased. Measles is the measles vaccine is safe, it's effective. It has been one of the most studied medical interventions in history because of these vaccine hesitants or anti-vaccine groups. It has been studied on hundreds of thousands of children in trials, in vaccine trials, in observational studies done after the vaccines were introduced, and even since then, even in recent years, when medical professionals, as a group, we know that it's a safe vaccine, but to be extra certain and to provide extra reassurance to people who are hesitant, there have been many tens and hundreds of studies on hundreds of thousands of children, which have shown that it is a safe and effective vaccine.
Speaking of a safe vaccine, do you think that it should become mandatory to have your children vaccinated? On Friday, I saw an article that was published saying that Germany's parliament had voted to make measles vaccinations compulsory for children in response to a global rise in the cases of the disease, and that parents would be fined up to 2,140 British pounds if they didn't get their children vaccinated. Do you think that that would be something that should be looked at in case we have an influx of people joining the anti-vaccine movement?
Okay, so in some countries, particularly in developed countries like Germany, like Australia, up until recently New Zealand, because they have not seen measles, their population, the people in those countries have not seen measles for decades. It's not something that's right there in front of them. They don't see children dying. You become complacent. It's seen as something that's not as much of an issue, and then you get groups that decide not to vaccinate. And governments in this country, health authorities in this country, have seen that when this happens, you get pockets of populations, pockets of people who do not get vaccinated. And they're fine if they remain in the country because they are protected by the herd immunity of everybody around them who has been vaccinated. These countries get cases, and it's the same for Fiji, when one of those unimmune people who choose not to get vaccinated travel outside to a country that has much less immunization coverage, and they get infected and they bring it back and they infect everybody else who's not immune in that country. And it's come up as a real public health problem in these developed countries. So this is why they've put in these measures to try and make sure that children do get vaccinated. So in Germany, as you mentioned, it's become compulsory to vaccinate. In other countries, I know it's compulsory that a child has to have evidence of immunization before you can get enrolled in school. So that is happening in other countries. In Fiji, so far, we have not seen it as that much of a public health problem yet. But of course, we are watching what is happening. We're trying to gauge what is our population of people who are vaccine hesitant, and then we will make decisions in the future. But right now, it's not compulsory, but we are very strongly urging people that please protect your children. Make sure your children have received 2 doses of the vaccine. I have a 6-month-old. Recently, we traveled overseas, and I made sure that he got vaccinated because 6-month-old babies can get vaccinated if they're traveling to an area that has an outbreak. So even though our national immunization schedule has the first dose at 12 months, if you're traveling with your baby overseas, especially to an outbreak area, they can get vaccinated.
Okay. When we're back in the next segment, we'll have more questions, especially regarding those who have not been vaccinated and especially why you do need to go and get yourself immunized. Welcome back. Dr. Sahu Khan, this is our final segment, and I thought that it would be prudent to touch on something that I had seen on the BBC website. There are numerous studies, like you said in the previous segments, in developed nations, and those studies have also been done in the UK. Leading scientists there have said that measles has a devastating impact on the body's immune system that could make it harder to fight off infections for years, and they're using the term immune amnesia. Talk to us about that.
Okay, so essentially what recent studies have found is that measles affects the way, once you get measles, it affects your response to other diseases in the future. So there are some diseases, a lot of diseases that if you have gotten it in the past, you'll get, you could use the term immune memory. So your body has actually learned how to fight against these diseases. So so dengue fever, for example, we have 4 strains of dengue fever. We know if you get infected with one strain, you should be immune to that strain for life. So what a disease like measles does is it affects your body's immune system so much that it essentially forgets how to respond to those diseases. So this is the latest evidence that has come out. So it is just an addition to the complications that we know that measles already has. So things like encephalitis, which is infection of the brain, severe pneumonia, severe diarrhea, severe ear infections, which is why we try our best to prevent measles in the first place. And we can prevent measles by making sure that our children have received 2 doses of the vaccine. And as I mentioned before, these 2 doses are available free on the Ministry of Health's national immunization schedule in Fiji. So ensuring that children receive 2 doses of the vaccine. I've heard some people saying that, oh, when I was a child, measles was very common, and I had measles, my friends had measles, and in fact, my parents used to say that, some parents would say, if your child has measles when they're young, you actually should take them and mix them with other children so they get it, and then if you all get measles when you're young, you're fine. It's better when you get it when you're young.
Is it sort of like mumps? Once you get it, then you don't get it again? Is that
yes,
the mindset?
So that was the mindset, that you get it once, you go through it, you won't get it again. If you get it when you're older, it's probably going to be more serious, get more serious infection. This is a thinking that is out there. So some people think, oh, why should I get my child vaccinated? I had measles, I'm fine. my point is that yes, you may have gotten measles and you're fine. Because the majority of people who do get measles will recover and will not have any complications. As I mentioned, there are a percentage of people who get very severe complications that put them in hospital and can actually cause death. If you think what I said about WHO saying that 20 million deaths have been prevented from 2007 to 2017, it's because children do die from the disease, and those that don't die but have the complications end up in hospital and may have severe effects for the rest of their lives.
And just so there's no misinformation that is spread out there, because we love to listen to what our aunties or what our uncles or what the neighbor said, there is a clear distinction between chickenpox and measles.
Yes.
Right. So could you tell us on how important it is for those who have symptoms of either maybe measles itself to go present themselves to the doctor instead of self-diagnosing or saying, well, you have a rash, we'll keep you at home, give you some Panadol or maybe give you some water, hydrate you, and you'll sweat it out and you'll be fine.
Yes. So in Fiji, in tropical countries, having a fever and a rash is something that may happen with other diseases. Dengue fever, we know you can get a fever and a rash. But right now, because we know that we have an outbreak in Seronomosi and there are outbreaks in the region, we have asked all of our doctors and nurses to keep a very strong, high index of suspicion for people who do come to hospital with a fever and a rash. And we are urging the public that if you have a fever and a rash and symptoms like a running nose, a cough, watery eyes, all of these together, we're asking that you notify your health officials in the area. So call ahead to your the normal doctor that you see. Call ahead to the health center. The reason being is that we are trying to avoid people just coming to a health center with those symptoms and maybe having measles and spreading it amongst the people who are waiting in the health center who may be very sick and maybe even more affected by the disease than the person that has it. So please be very aware of the signs and symptoms of the disease and call ahead before you come to a health center.
Dr. Sahu Khan, I've got a workmate who will be traveling to Australia soon, and she's actually gotten so scared about contracting the disease, whether she's in the country or when she gets to Australia. So she's gone out to get herself immunized as we speak today. However, for someone like myself, I know I had gotten my shots when I was in primary school. Is there a reason for me to go to the health center and get a booster shot now, or is it okay for me to just practice good hygiene and make sure I don't interact with someone who has symptoms?
Yep. So the short answer to that is that you do not need to go. We're not advising for everybody to go to a health center and get vaccinated. We are targeting specific groups who are at higher risk of getting the disease. So the specific groups, as I mentioned, are children. We make sure that they get those 2 doses according to the national immunization schedule. The second group is anyone who's traveling overseas, anyone who's traveling to the outbreak area of Seronomosi. And the third group, of course, is anyone who's living in Seronomosi right now. These people should get vaccinated. And the other groups, of course, are healthcare workers, people who work in the airports, in the airlines. These people should get vaccinated. We are not saying for everybody to come and get vaccinated because, again, measles is a disease that is not widely prevalent in Fiji. We know that maintaining good herd immunity will protect the rest of the population. But again, this is being continuously reviewed by the measles task force that has been set up by the Ministry of Health. And if we need to make any changes in the future, these changes will be made.
One last question, I suppose, is for those who wish to be a little more cautious, those that are not going to be going to get themselves immunized because they're safe, good hygiene practices, what would you recommend?
Well, measles is a very contagious disease, so it is airborne. We know that in a population, if you have 10 people in a room and they're completely not immune to the disease and someone comes in that has measles, about 9 of those people will get it. That's how contagious it is. So the real prevention is vaccination. However, we always urge the public to practice good hygiene. Things like when you cough, make sure you're coughing into a handkerchief or a tissue. And if it's a tissue, you're throwing that tissue away. If you don't have a handkerchief or a tissue with you, cough into your elbow like this. The reason you do this is, first of all, you're not spreading that cough everywhere to everyone else. You're also not contaminating your hands. Because once you cough into your hands, your germs are on your hands and you can spread that to other people. So having good cough hygiene is very important.
Thank you very much for coming on to the show, Doctor, and we wish you and your team all the best. That's all we have for you tonight. Join us again next week. Vinaka.